So LASIK has been around for longer than SMILE. SMILE's still been around for quite some time, but LASIK definitely has been around for longer. LASIK we'll start with because it's been around for longer. It's a flat-based procedure. So with LASIK, I use two lasers. I use both the VisuMax 800 and the MEL 90. So the VisuMax 800 is a femtosecond laser. So when people talk about LASIK, there's the very old LASIK that not that many people do anymore, which is called the microkeratome or the blade LASIK. And that's really not really done anymore in most places because we have much better technology now. So we have the femtosecond laser, which is the bladeless laser, and that creates the flap, which is the first part of the LASIK procedure. Then the surgeon, so myself, surgically lifts that flap. And then I use the excimer laser, which is the MEL 90, to give that refractive treatment. So the refractive treatment is essentially your prescription in your glasses or your contacts. We obviously have to tweak that a little bit, but it's that script that you're wearing that we can put inside your eye. Then the flap goes back down, and that is the procedure for LASIK. SMILE Pro is the latest version of SMILE. SMILE Pro has been also around for a few years. It's not completely brand new by any means, but it's a newer version of SMILE. And this is different to LASIK. So with LASIK, we create a whole flap in the cornea or the front part of the eye. With SMILE, only a very small incision is made. So my incision's around 2 millimeters. So that's similar to the incision that's made in cataract surgery. So it's a very small incision that's made in the cornea again. And it only uses one laser. So with us, we use the ZEISS VISUMAX 800. So that's the only laser that can technically deliver SMILE Pro. So there's older versions of the ZEISS lasers. So the VISUMAX 500, which is your traditional SMILE. And then the VisuMax 800 is where we call it the Pro or the SMILE Pro. That's just because it's the latest version. And it has advantages that the older lasers don't have. So with SMILE, a small incision is made, and then the laser actually creates a disc inside the cornea. And the disc is generated again based on the type of, like the degree of refraction that you have. SMILE Pro can now be done for both long-sighted and short-sighted patients. So traditionally it was just short-sighted patients, and usually in the range of around a -2 script to around a -8 to 9 script. That was kind of the range, with up to 5 diopters of astigmatism. So that, when the cornea is not shaped like a ball, it's shaped more like a rugby ball. That's when you get astigmatism in your eye. So we can correct for that with the laser. So SMILE Pro can do both long and short-sighted scripts. The long-sighted version is much, much newer as of this year, whereas the myopia or the short-sighted version has been around for quite some time. And the reason why it's Pro is because it's not just for a cool name, but it's because the speed and the accuracy of the laser is just a lot better than the old version. So the time to create that little incision and that disc, that refractive disc that then I surgically remove from the eye, is minimized greatly. So depends again on the size of your prescription, but the surgery can be, very, very quick. Like we're talking under 30 seconds in some cases. And that's important because it means that there's less time that the laser is actually on the patient's eye. So the suction cap for the laser is on the patient's eye. So complications like what we call suction loss, so that's when the laser disconnects from your eye, or just the time for treatment, anxiety levels for the patient, all of these things are dramatically reduced when the time of treatment is dramatically reduced. So you really don't see as many complications anymore. It's a very safe and effective procedure. And then the surgeon, so that will be me, will remove that disc from the cornea, and then you're left only with a very small incision. So it's slightly different to LASIK because you don't have that big flap, but they both have very similar end outcomes in terms of the vision that you're getting.